Hello, it's Dr. Chris Marshall here at Medical Specialty Clinic, and today I wanted to do a video about GERD, or Gastroesophageal Reflux Disease. So this is a huge problem for millions of Americans. Some people estimate that 25% of the U.S. population will suffer from acid reflux symptoms. And then on top of that, there are medications that are very commonly taken for it that actually can cause trouble if they're taken too long, or in certain cases they can cause some trouble as well. So you don't want to take medications, prescription medications, any longer than you need to, and you certainly want to make sure you're taking it for the right reasons. So I just wanted to touch on that today. So first off, we'll talk about what is gastroesophageal reflux. So that's a long name for something that's really not all that complicated. Basically, when we swallow food or drink, then it goes down through the throat into the esophagus, and then that goes down into the stomach. Well, in the stomach, there's a lot of acid, hydrochloric acid. Our body makes hydrochloric acid to help us digest our food, and that is protons. It uses a chemical reaction to create hydrogen ions, and that is called a proton. That acid is used to digest food. Well, if it stays in the stomach, then no problem. That's what it's supposed to do. The stomach has a nice protective mucus lining to help protect it from the acid. However, in a lot of cases, humans tend to overeat. So over time, the junction where the esophagus meets the stomach will get stretched a little bit. You can even get a hiatal hernia where the very top part of the stomach gets pushed up through the diaphragm just a little bit, and then that makes it a lot easier for food and liquid from the stomach to make it back up into the esophagus. Anyway, when acid or other things make it from the stomach into the esophagus does not have that protective lining. It does not have a mucus lining to help protect it, and it can actually damage the esophagus. Reflux can actually be so severe that it goes all the way back up into the throat, and that can cause all sorts of trouble. You can have sore throat, more ear infections, your tonsils can get enlarged from the inflammation, and a lot of people suffer from asthma because of it, because the airway is at the back of the throat as well, and it's very sensitive to acid, as you might imagine. So just a little bit of acid can cause an asthma attack, chronic cough, reactive airway disease, all sorts of different problems. So acid reflux, if it's not treated, if it's out of control, can cause quite a few things. And then sometimes the stomach itself, that mucus lining, that protective barrier, can get damaged for various reasons. Bacteria sometimes can cause that. Stress can cause breakdown of the mucus barrier and other things. When that happens, you can get ulcers and bleeding in the stomach. But in the esophagus, which is more easily damaged, you can also have that irritation, bleeding, ulceration. In the esophagus, the cells of the esophagus are not used to that acid. They try to react to that, and they can change, and that actually can lead to cancer. There's a disease called Barrett's esophagus, where acid irritates the lining of the esophagus enough that the cells try to change from squamous epithelium into columnar epithelium, and that actually can induce cancer formation in the esophagus, and that is not good. So you don't want to let acid reflux go untreated for too long, because it can cause lots of trouble. All right, so what do we do about acid reflux? Well, there's lots of different treatment options. Everybody's probably heard of Tums. That is a brand name, obviously. There's other companies that make similar products, but that is typically calcium carbonate or something like that, that is very basic, that raises the pH. So acids have a low pH. So in the stomach, typically the pH is very low, it's very acidic, and we want to raise that to help make it more neutral. And so a base would balance out the acid and make it more neutral. So water is a neutral pH. Acids are very acidic, low pH. Bases like baking soda and calcium carbonate, things like that, are going to have a very high pH. So that's the difference between acids and bases. So acids help us digest our food, but too much of anything can be bad. So we can balance that with some bases like calcium carbonate or baking soda. You can actually take some baking soda occasionally, and that can help with acid reflux. And then there are other things that kind of slow down the acid or decrease it, and those are histamine blockers, specifically targeting the stomach and the GI tract. Zantac would be one of those. That's come under a lot of controversy lately for some problems that developed from that. But Pepcid would be another brand that is famotidine. That you can take, and long-term effects of that don't seem to be too bad. I wouldn't recommend you take anything if you don't need it, but the Pepcid or famotidine does not seem to be too bad to use for long-term if you need it. And then other medications are the proton pump inhibitors. That's going to be your major medication. So some of those names, brand names that you probably have heard of: omeprazole, Nexium, the purple pill, and then Protonix, Prilosec, things like that. So Prilosec is a brand name. Omeprazole is the generic, and that is actually, I believe, the 10th most commonly prescribed medication in the United States. So millions of people take omeprazole. The others are very common as well, just that's the most common one. So that is omeprazole again, and that is a very powerful medicine. Those work by blocking what we call the proton pump. So that's kind of the last step before protons or acid gets dumped into the stomach, from the cells into the stomach to help us digest our food. And that's a very powerful blockade. They work very well. The problem with them comes in later when you try to stop taking them. So all that acid builds up, and it's kind of like, think about it like a dam holding back water. So in the stomach, there's that proton pump has been blocked, and behind that is all this acid that's been built up and is just ready to get released. So if you stop taking your acid reflux medicine, your proton pump inhibitor, then all that acid will be dumped into the stomach, and you can have the worst acid reflux you've ever had in your life, even worse than before you started taking the medicine to help with acid reflux. So that can be a huge problem. So you usually have to wean off of them and take other things to help. So there are other options to help decrease acid reflux other than medications. But I did want to mention some of the problems from proton pump inhibitors. Some of the major issues are proton pump inhibitors have been associated with some negative problems if they're taken too long. Typically, you want to take them for about 8 weeks, sometimes a little longer than that, but unless you have a really good reason, you don't want to take them longer than that. Now, if your doctor tells you that you need it, that's different. So if you do have a peptic ulcer disease or you have Barrett's esophagus, then a lot of times you're going to be on them a little longer. But if you don't have those things, then I would recommend you treat it in another way that doesn't have the long-term problems associated with proton pump inhibitors. So some of those problems are irritable bowel. They can actually cause some irritable bowel symptoms. That causes trouble for a lot of people. It can actually decrease your absorption of certain vitamins and minerals, things like B12, calcium, magnesium, iron. It can decrease the absorption of those. Increased risk of some osteoporosis or osteopenia, which gives increased risk for breaking a bone or fracture. So you want to make sure you get your calcium and magnesium absorbed in your diet. Those are very important. So another area is yeast. It can actually allow some yeast to overgrow, and that can cause trouble for lots of people. Intestinal bacterial overgrowth. Some bacteria gain an advantage when you take proton pump inhibitors, and they can become dominant, and that can cause trouble, and it can lead to what we call small intestinal bacterial overgrowth. That can be a problem. Infections with other bacteria that are much worse, like Clostridium difficile or C. diff. There's an increased risk of C. diff with proton pump inhibitor use. They also are linked with an increased risk of dementia. So that's a huge fear for many people these days, is they don't want to develop dementia. So I would recommend not taking proton pump inhibitors any longer than you need to for that specifically. And then also, recent studies have shown a link with chronic kidney disease. So that is obviously not good. So you want to protect the kidneys. We need those to work as well as they can forever. So just some thoughts, some increased risk of problems that proton pump inhibitors can cause that I want you to be aware of. And discuss that with your doctor and let them help you get off of these things. So going back to the first, I said acid reflux can cause all these problems. So if it is causing problems, and we want to try and stay away from some of the better treatments for it, like proton pump inhibitors. What else can we do? Well, there are a few things you can do to help treat acid reflux. Obviously, the first thing, typically, weight loss is a huge. If you're overweight, then losing weight can absolutely help with acid reflux. Elevating the head of the bed at night when you sleep, just a few inches. A lot of people put like a brick under the legs of the bed on the head and raise it up just a little. That can help some. Diet, if there's something in your diet that triggers acid reflux, spicy foods or chocolate or nicotine in cigarettes, things like that can make it worse. Try to avoid those, obviously. Fatty foods, for some people, will trigger an episode. Lettuce is another one, oddly enough, that can trigger an attack sometimes. If it doesn't bother you, you don't have to worry about it. But if there are foods that you know aggravate your acid reflux, then try to limit those. Carbonated drinks are a big problem. Anything that makes you belch, when you belch, that is by definition acid reflux. Something's going from the stomach up the esophagus and causing you to belch or burp. So try to avoid those. Hard candy, lozenges, things that make you salivate or increase salivary secretions, that can help. Tobacco and alcohol, avoiding those. I mentioned that a little bit earlier. And then old natural remedies that people have been using for thousands of years, things like slippery elm bark. I know it sounds weird, but that is a natural remedy that's been used for a long, long time. I'll put some information on that in the description. And then aloe is another option. Aloe can help with digestion. Marshmallow root is another. And then licorice. Licorice is a big one. Now, you want to get the deglycerinated licorice to take. That when they remove the glycerin molecule from it, that helps keep it from raising your blood pressure. So plain licorice or plain licorice supplements can raise your blood pressure, so you have to watch out for that. But there's 4 things that you can try naturally to take and help with acid reflux. I've gotten several patients that have great relief from those. So that's licorice, slippery elm bark, marshmallow root, and aloe. And we actually carry a product here at the office that has all 4 of those together, and it works very well. Natural, much lower risk of any long-term side effects from taking that. So I would definitely recommend that over long-term use of a proton pump inhibitor. And some people need to take those supplements when they're trying to wean off of proton pump inhibitors because that can be so hard to do. I will put some information in the description. Appreciate you tuning into the video. If you got something out of the video, please like and subscribe. Thanks again. Look forward to seeing you in the next one.